Guys, this is Dr. Mobeen from Drbeen. At Drbeen, we wanted to make sure that we discuss some of the questions that we are getting about the coronavirus. So the first one is, what are the similarities of coronavirus with flu virus? So let's start discussing those similarities. First of all, the symptoms, the presentation of the patient, the feeling that patient gets. Both of the viruses actually have similar presentation or symptoms. Both can cause cough, sneezing, fever, body aches, even vomiting and diarrhea. Both can have that. So you cannot tell from those symptoms that it is coronavirus or it is flu. Then is the transmission. Both of them can be transmitted from one person to another person. And that is usually from the droplet transmissions, or in case of coronavirus, this can be aerosol as well. I'll discuss that later on. The transmission is that if I am sick and I am coughing, what will happen is that this air that exits is going to go for up to 2 meters. If I'm sneezing, even longer, and the droplets that are coming out of my mouth would have coronavirus or flu virus on it. And when these droplets enter the other person, they go and they stick to their respiratory system and cause the infection there. Remember, the infection of a virus means the replication of virus, the division of the virus, the multiplication of the virus. And the disease by a virus means that when the infection or the replication of the virus is sufficient that it causes the organ systems to become damaged, then we say the disease has occurred. Now, so the transmission is through the droplet for both of them. And fomites as well. What is a fomite? And this is something that I would really like all of you to be aware of so that you can wash your hands and stay away from the fomites. Fomites are, if I am sick and I touch my lips or my nose or my eyes and then I touch some surface, that virus, that particles that now got stuck to my hand are now on that surface as well. Both of those viruses can survive on those surfaces, and when somebody else touches that surface and then touches their mouth, ear, or mouth, nose, or eyes, they can add that virus back into their system as well and become sick. And now remember, people who are not yet sick. So imagine if I got the virus today, both flu or coronavirus. If I got that today, I may not have the symptoms yet, but my respiratory system might have replicated viruses which I, when cough or sneeze or talk or breathe, these will be transmitted. Although the transmission in this way is less common and rare, but still that can happen. Another similarity in terms of treatment is that both of these viruses do not have the medications for them. So the treatment is more supportive, so providing the fluids and keeping the person, the fever down. Although in the cases of viruses, if the fever is kept up, it actually helps kill the viruses. But managing the symptoms is one way of treating. And in case of severe symptoms, of course, hospitalization and then ventilator and oxygen and other such measures may be needed. Then is the infection itself. Both of them cause upper respiratory tract infection. In case of coronavirus, this novel coronavirus, or the SARS-CoV-2 as we're calling it, that can actually cause respiratory tract infection in the lower parts as well, because it is a species coming from animals, and that species can replicate at 37 degrees centigrade, which can involve the lower respiratory system plus other organ systems. Human coronavirus can replicate only at 32 to 35 degrees, which is this area, which is cooler. That is why human coronavirus, every year we have, I think all of us have it, 10 to 15% of the people develop the flu-like symptoms or cold-like symptoms, but in the upper respiratory tract. The novel coronavirus has this unique capability that it can actually go deeper and in the organ systems too. Then are the differences. So look, from the symptoms, if there are two people who are coughing and sneezing and have fever, you can't say that one of them has flu virus and the other one has coronavirus unless you have done the testing on them. So there is no difference in terms of symptoms. In terms of transmission, as I had said before, both can do the droplet transmission. They both can be transmitted by the droplet and the fomites. However, it is suspected that coronavirus can also be transmitted by aerosolization. What does that mean is that if I am sick and I am breathing here, the tiny droplets that are coming out are now suspended in the air and they're just sitting out there. And I have left, but those droplets with the coronavirus sitting on them are here. And if somebody else passes through this area, they might pick up those droplets. So this is called aerosolization. Aerosolization can also be that if there is an infected animal and that animal is dead, or there is poop of that animal on the floor in the mud, and then the dirt kicks up, that would also project the aerosolized pathogen in the air. And if somebody inhales that, they can have the infection. This is not true for flu, so that is a difference. Again, you cannot see that difference, you cannot tell that difference. Then is the treatment. Both have supportive treatment. They both do not have antivirals, although there are so many antivirals being tested right now, like ritonavir or remdesivir, but they do not have a treatment yet. In case of vaccination, flu virus, of course, have vaccinations. However, for coronavirus, there are vaccinations that are being developed right now. So there is no vaccine available at this time. In terms of infections, of course, flu virus has billion people infected and hundreds and thousands of deaths every year. On the other hand, coronavirus species just started. It only has 110,000 people infected, but it is infecting them very rapidly. And the death rate is at this time 2 to 2.5%. Various countries are reporting different death rates, and I think it depends upon how they're measuring that and how they're looking at the death rate, and if they even know which people are infected or not. So the death rates are different and they are evolving. So thank you very much. And the most important thing for you to do is to wash your hands, number one. Number two, if you're in public places, stay away from crowds, stay away from sick people. And number three, if you have touched a fomite, if you have touched a hand grill, or you have touched another doorknob or handle or something, do not then bring your hand to your face or nose or eyes. That is how you are going to pick it up from the fomites. So make sure that you are washing 20-30 seconds. Maybe sing a song that is 20 seconds long, and while washing, sing that song and allow yourself to have that time done. So I do sing a song. I'll sing that song to you when you ask. Thank you very much. Stay safe.